So when we look at your hand here, you've got this cord right there, and that's the Dupuytren's cord. Dupuytren's is a condition of the palm that involves the tissue of the palm kind of contracting in. You're more likely to get it the older you get, and it's more common in men, but not exclusively so. The treatment is usually initiated when one can't put your hand flat on a table. So we call that the tabletop test. And if you're unable to straighten out your hand so that you can put it flat on a table, or that you're bothered by the contracture and can't do the activities you wish, that's when we consider treatment. Well, what we were planning on doing today is doing that needle procedure we talked about in the office last time. And what we were talking about is what we would do is numb up kind of along this little cord, and then once the skin is numb, use a little needle to cut that cord and try and get that finger more straight for you.
Okay.
The risks of doing that: risk of infections less than 1%, risk of us not getting any straighter than what we are now, risk of injury to the blood vessels, nerves, or tendons, but that's very unlikely.
Okay.
Okay. The advantages of this is that the patient can leave the office knowing how much correction they get in their Dupuytren's contracture, and in general, they're wearing a Band-Aid or a soft dressing. Patients often have a splint for nighttime use, but in general, they don't require a lot of therapy. Little cleaning solution to kill any germs that live on the skin.
Doing a little better, Helen.
All right, you doing all right here?
Oh, yeah.
All right.
I'm with you.
All right. Things feeling a little bit more numb, kind of in the fingers here. Just on the skin here.
Yeah.
How you doing?
Good.
Good.
I'm feeling that though.
Don't feel anything? Good.
Good.
Okay. I'm going to have you go ahead and push down on the hand. Push down a little bit. And then go ahead and straighten out for me. What do you think?
I think he looks better than he did.
I think we're pretty straight, pretty close to neutral. Huh?
I think so.
All right, this one we didn't
Well,
change. That's
no,
that old one.
I think he's done for.
And then these guys are pretty much
Good.
straight out. So what we do now is get you a little bandage, and you just have three little poke holes, and that's
Very
it.
simple. Yes.
Do you think it was worth doing?
Well, I think so. I think it's going to help me a lot.
All right. See if you can get some sympathy. And you can take this off later on today
Okay.
and start using the hand pretty normally.
Well, wonderful.
No restrictions. That numbing medication just in the skin will last for a couple more hours, maybe 1 or 2 at most. And then
Sounds good.
making a full fist. No problems there.
No. Not at all.
So we'll turn you loose.